Hey, this is Nick replying to Amber's post. Yeah, you had a great post. I echo a lot of what you said, um, especially the part about being proactive. Um, definitely try to. I like when you work together with a doctor who is proactive as well. They find the best course for the patient. They do order the UDS and they look at the prescriber base for um, to see how many prescriptions they've obtained before and that type of thing. And um, they just say, hey, you're not gonna, that's not gonna happen today. It's good to work with that. And I find that that's more and more difficult to do, just because a lot of the docs are, you know, I don't know if it's just some of their groups that they work with are more concerned, about the patient satisfaction scores, and with some of your repeat patients, they don't always get a survey. The ones that have been there, within 90 days usually don't get another survey, but it's in a busy and you have a lot of work to do, and I find sometimes a lot of the docs will just kind of give them what they want and out the door. Um, but yeah, I think it's totally a key factor to help these patients, um, not abuse narcotics is be proactive. And when you were talking about your friend who became addicted to medicines just due to her chronic back pain, on the in the other discussions, there was a talk of uh, iatrogenic addiction, which was a term that I wasn't familiar with. So I looked it up, looked at their resource, and basically that's like uh, opioid addiction related to caused by healthcare. And I thought it was pretty interesting. Found an article um, that talked about rational uh, prescribing to prevent the iatrogenic addiction. And this guy talked about the patho of why people become addicted, and he talked about the peaks and troughs that some of these medicines have, that like oxycodone and hydromorphone and stuff like that. They have a quick onset and they peak quickly, and that produces a lot of dopamine. And they like this effect, and then it kind of goes away quickly, and they just kind of chase that peak and trough. Um, he also talked about educating patients, and giving them a realistic goal of treatment, that your pain's not going to be zero. Uh, you have a chronic issue, you should probably expect a four, 4 or 5 range out of 10 on the pain scale. So yeah, enjoyed your posts, and thanks.